Hi, my name is Dr. David Kulla with Synergy Wellness in New York City, here to talk everything about rotator cuff injuries and give you 7 of my favorite rotator cuff exercises. Let's get right into it. The 4 rotator cuff muscles, being approximately 10 to 12 millimeters in thickness, are made up of the supraspinatus, the infraspinatus, the teres minor, and the subscapularis, with the supraspinatus being the most commonly injured of these muscles. Now, these muscles arise from the scapula and attach to the humerus, making the shoulder socket, aka the glenohumeral joint, stable. Rotator cuff injuries are common and increase with the age and job specifications, especially if you're required to do a lot of overhead activity like painters or electricians, for example. It's important that all of you understand the difference between a muscle and a tendon. Muscles attach on both ends, to the tendons, whereas tendons attach to the muscle on one end and to the bone on the other side, connecting the muscle to the bone or joint. Now, 3 of the most common types of rotator cuff injuries include, number 1, and probably the most common, would be tendinitis. Simply put, it's inflammation of the tendon and possibly the muscle belly too. Number 2 would be a rotator cuff sprain or strain. A strain, with a T, involves tearing, which can be further classified into 5 types. Or overstretching the tendon or muscle, does not have to be a tear. Whereas a sprain with a P involves torn ligaments, which technically attach bone to bone and are not technically rotator cuff muscles. And the 3rd most common injury is shoulder impingement, where the rotator cuff imbalances or weaknesses create an impingement in the shoulder joint or shoulder joint capsule itself. So how do we best diagnose rotator cuff injuries? Well, the only way to diagnose with specificity is by MRI or CT scan. X-ray will tell you if there is a fracture, a break, arthritis, or shoulder misalignment. It will not look at the muscles, tendons, and ligaments. Now, some of the common symptoms are pain across the top or back of the shoulder, inability to sleep comfortably on that affected shoulder side, shoulder weakness, or cracking in the shoulder when moving the arm, or a limited ability to move the arm, limited function and mobility. Now, a few complications that can arise and that are worth mentioning if not treated properly. You're going to have poor shoulder mobility. You're going to have joint instability, and you will eventually develop osteoarthritis. And then there's also the chronic pain that you're going to deal with. So let's go into some of the best treatments for rotator cuff injuries. First, imaging needs to be done. If there was trauma and fracture or break is suspected, X-ray may be necessary prior to an MRI. Hands down, the most effective and safest treatment for the pain and initial healing process is cold laser therapy, also known as low-level laser therapy or deep tissue laser, which heals any strain, tear, or tendinitis 40 to 50% faster by exciting your own body's mitochondria to speed up the healing process. What's better than that? Well, number 2 is to rehab it, and that's done with exercise rehab. Hang tight. My 7 favorite exercises are coming right up here in a few seconds. And the 3rd treatment is to have the shoulder alignment checked by a CCEP, a certified chiropractic extremities practitioner that adjusts not only the spine, but the shoulder joint too. And at Synergy Wellness in New York City, we do adjust shoulders and extremities, and I am a CCEP. So the shoulder is the most unstable joint in the human body, having only one bone, the clavicle, holding it to the axial skeleton, and the joint being able to move 360 degrees. The rotator cuff muscles and tendons can't possibly heal properly if the shoulder joint, scapula, or clavicle is subluxated or misaligned. If these are done, you will avoid surgery down the road, and trust me, those outcomes are not great. Fix it now. Now, I hope you learned something from this video, something that you haven't heard before, and I hope you enjoy my 7 favorite rotator cuff rehab exercises. Don't forget to kindly subscribe, give me a thumbs up if you enjoyed or learned anything from this video or picked up any new exercises that we've provided here. Thanks.
Stand in an upright position. Bend the elbow of your symptomatic arm to a right angle. Keep your shoulder blades back and down and rotate your arm outwards, keeping your elbow loosely by your side and your shoulder blades in a good position. Control the movement back to the start position and then repeat. Hold a resistance band in both hands and gather up some tension. Start with your hands at chest height and your arms straight and move them out in a T shape, keeping your shoulder blades back and down. Control the movement back to the start position and repeat. Stand in an upright position. Hold a tensioned exercise band in both hands and bend your elbows to a right angle. Keep your shoulder blades back and down and rotate your symptomatic arm outwards, keeping your elbow loosely by your side and your shoulder blades in a good position. Control the movement, then return back to the start position. Relax and repeat. Sit in an upright position. Rest your symptomatic arm out to the side on a table or solid work surface. Your arm should be at approximately 90 degrees out from your body. Bend your elbow to a right angle. Maintaining good posture and shoulder blade control, rotate your arm upwards so that your forearm moves off the table from horizontal to vertical. Your elbow should remain at a right angle and your posture should stay straight with your shoulder blades pulled back and down. Slowly return to start position and repeat. Sit in an upright position, holding a resistance band in the hand of your affected arm with the other end secured to a solid anchor behind you, such as the chair back or a door handle. Have somebody hold this if needed. Place your affected arm out on a table or work surface at approximately 90 degrees to your body. Bend your elbow to a right angle, and hold the other end of the resistance band in your hand. Maintaining good posture and shoulder blade control, rotate your arm upwards so that your forearm moves off the table from horizontal to vertical. Your elbow should remain at a right angle and your posture should remain straight with your shoulder blades pulled back and kept down. Pull against the resistance band and then return to the start position and repeat. Lie on your front with your arms by your side and your palms facing downwards. Pull your shoulder blades back and down and then lift your arms an inch off the floor. Hold and then slowly relax. Note a weight can be added to your hands to increase the difficulty of this exercise. Lie flat on your back with your affected arm on a pillow by your side. Bend your elbow to a right angle with your fingers pointing to the ceiling. Place your other hand on the outside of your affected wrist or forearm. Push outwards with the affected hand with half your maximum effort, using the other hand to resist the movement. Your good hand must be on the affected wrist and not on the hand. Hold and then relax.